Tens of thousands of people are affected by recent mass shootings. Joining us now to help us better cope with the pain and the aftermath of a shooting is Dr. David Spiegel with Stanford Healthcare. Dr. Spiegel, thanks for joining us. We want to talk about how all of us can try to cope, because just seeing this on the news and us reporting it is emotionally difficult. But let's focus more on the immediate victims of this, the survivors of mass shootings and their families. How can they get help? What do they need to know to get through this difficult time?
Well, you know, the reality is suddenly and painfully torn apart and changed. And the thing that helps the most is a sense of connection with other people and an acknowledgement of just how disruptive, painful this is, to not pretend that things are any better than they really are. It threatens everybody. If it could happen to them, it could happen to anybody. So the shared sense of danger and grief is something that is a sensible thing to do to help people come to terms with these terrible losses.
So those are, when you think about those immediately affected, of course, in the broader community, people can say, well, I just don't watch the news or I won't read the paper. But nonetheless, these things do have an effect on all of us, a feeling of hopelessness, helplessness, even feeling vulnerable. You alluded to that. What is your general view of how the general public should approach these kinds of tragedies?
I think, sadly, we all have to take it seriously. It's a part of our lives now. Gun deaths are one of the leading killers, the most frequent killers of young people. There are 330 million handguns, more than one for every person or guns in the United States. These things have happened. They happen just now. They will happen. It's a dangerous situation that we all need to face. And the best thing to do for these poor families that have lost their loved ones is to acknowledge and comfort them as they go through their process of grieving their losses.
There's a lot of this American kind of macho attitude of suck it up and get through it, particularly among first responders. I know that attitude for them has certainly changed over time, where they are now more open to seeking help and getting help and realizing that you need help. So what do you say to those who say, you know, get through it, kind of suck it up? It's okay to ask for help, right?
They could not be more wrong. It's okay. It is an important thing to do, to come through it as best you can. These people's lives are damaged, just as their loved ones have died, and they need to come to terms with that. And pretending that it's not as terrible as it is a disservice to them, disrespectful to the people who were killed, and it is not helpful for anyone's mental health to pretend that a disaster like this didn't happen. So sucking it up could not be more wrong.
As a professional, do you have a concern that the nation is becoming numb to hearing of these kinds of tragedies over and over and over again, year after year?
I do worry about that. I think it's astounding that we live with the level of danger that we are all living with now, because there are too many firearms. You know, it used to, when the Constitution was written, it took 5 minutes to load a musket. And now you can carry around a handgun that'll kill 30 people in 30 seconds. That is dangerous. It's as dangerous as a lot of the other dangers we have to face. And unfortunately, it's not a necessary one. So we do need to face that common danger and do the best we can to reduce it. And part of it is to take seriously threats that happen. I've heard that the killer was threatening to split the brain of somebody, one of his coworkers, with a knife. When you hear people making threats like that, you have to take them seriously.
You're sitting down with a survivor, a family member of somebody who lost their life in Half Moon Bay. You're sitting down across from that person. Where does that conversation start? What does that person need to know immediately when you sit down with them?
Just acknowledge just how life-transforming and awful this is. I'm terribly, terribly sorry for your loss. We'll do what we can to help. And you need and deserve all of the comfort that we can provide. And so talking about it, thinking about it, crying, dealing with the loss is exactly the right thing to do. At an insane time, doing the things that acknowledge that it's an insane time is the only way to keep your sanity.
Whether it's been wildfires or floods or COVID, we've had multiple things to have to deal with as a society. The broader concerns of supporting one another through these difficulties, your recommendation?
is that we openly acknowledge them, that's an important thing about the ceremonies that we have, the ceremonies of grief. Leaving flowers, leaving little things on a fence near where the loss happened, are ways of feeling that you're part of a community that is grieving. It isn't just the families, but our community has been invaded and damaged. And so the one thing that can provide some comfort is the sense of social connection and glue and acknowledgement that we're all suffering together.
You have to hear from these folks who are going through this kind of trauma. How do you get help? How do you deal with this? Because this must be traumatizing to you as well.
Well, it is, and it is true that people who provide help do pay a price, nothing like the price that they're paying. And I would say that what comforts me is the sense that in some way I am bringing some comfort to these people who were so much more afflicted than I am. And that makes me feel very sad, but also good if I can be of help.
Dr. David Spiegel with Stanford Healthcare, thank you for trying to give us all some advice on how to navigate these challenging times.
You're most welcome.
Thank you.